Hello guys, how are you doing today? Welcome back to my channel. I trust that you guys are doing great. As you guys can tell by the title of today's video, we're still discussing fibroids, and as I shared in my previous video, today we'll be discussing fibroids medically. And I have with me here my very own immediate younger sister. She's a medical doctor, and very shortly she'll be introducing herself. So today we're hoping to discuss fibroid management, symptoms, everything around fibroids that will be good for you to know. So I hope that you stick around to the end of this video to have your questions answered. If you like any questions to be answered that will not be discussed today, that is probably not discussed at the end of this video, you can leave it in the comment section and we'll definitely attend to it. Without further ado, let me introduce you. Okay, our guest today will be introducing herself. Please welcome. How are you?
Hi guys, I'm Dr. Adirunke. It's so good to be here, and I'm glad I'll be sharing some insights into, fibroids and everything about it generally. So
Thank you. Thank you. And you guys have heard it. She's a medical doctor, and I'm very proud of her. Anyway, let's just go into the discussion for today. So, first, we need to understand what fibroids is, and we'll delve deeper into other areas. So, what are fibroids, and who are the people affected by fibroids?
okay. I know a lot of people have some misconceived idea about fibroids. Most people think fibroids are cancerous growths, but fibroids are non-cancerous growths. They are benign tumors. That is, they're not malignant, unlike cancerous that can spread and can get wide. Fibroids are very minute or tiny growths. They can be big in size, but they are non-cancerous tumors that grow in the uterus of a woman. And basically, they are common in reproductive age group, women from the age of 25 to about 45 before they get into their menopause age. Sometimes, on very rare cases, it happens below 20 years of age or below 25
Okay.
years of age, rather.
Because I was about to
But
ask that question actually. So, thank you for.
yeah, yeah, it's in rare cases, but we can see because some women attain menarche, which is the age at which a woman starts, seeing a period earlier than some other women. So the earlier you attain it, the earlier your or the higher your chances of having fibroids at the early age. So that means you're entering into your reproductive age group earlier. So generally we have African Americans, or basically Africans, that are basically at risk of fibroids. Reason why we do not know. I mean, if you're a black woman, you have a high chances of having fibroids. So generally, aside from being African, it's said to be genetic. Reason still unknown, but fibroids generally are hormonal. They are supported by hormones. So that's why, remember I said earlier that it happens in or it occurs in reproductive age group women. So the hormones that support reproductive system actually supports the growth of fibroids. So we have the estrogens, we have the progesterone. Those are like the dominant women hormones. So fibroids generally, they're like muscular or fibrous tissues that grow in the uterus. So they are supported by that hormones. So every woman in their reproductive age group has the tendency to have fibroids. But we all women have fibroids? No, but every woman has the tendency to have fibroids, because you even see a woman that attains menarche at a earlier age and all through her life she does not have any fibroids, and you see a woman that attains menarche at a later stage and then has fibroids. But like I said, all women has the tendency, especially African women, has the tendency to have fibroids, but not all women will have fibroids. Also, generally, most women have fibroids. Most young women have fibroids in their 20, in their early 20s, their mid 30s, thereabout. They have fibroids, but they do not know they have fibroids, because generally fibroids can be very asymptomatic. That is, does not present with any symptoms until it is being discovered. Sometimes it may not even present with any symptoms until pregnancy. So generally, most women go about carrying fibroids. It may be multiple, it may be one, and they're not aware about it. Also, before I move further into discussing that, like the symptoms of fibroids, I also like to talk more about the causes, or what can predispose you to having fibroids. Like I said before, fibroid is genetic. So if you have a relative, like a cousin, a sister, or your mom that has a fibroid, your chances of having a fibroid is also very high. generally, I said before, fibroid is genetic, so there's no known cause. It can just happen without, because of that hormone. But if it happens because your relative has it. It happens because you're a black woman. It also happen because of lifestyle choices, like what kind of food you eat. I mean, eating having a health diet reduces your chances of having fibroids. For example, if you consume too much of red meat, if you consume too much of carbohydrates, sugars, those things, I'm not saying they definitely will, but they increase your chances of
Yeah,
having fibroids.
contributing factors. Yeah.
Yes, in contributing factors to you having fibroids. Also, if you're a young woman in your reproductive age group and you're not getting pregnant, like if you're like the longer it takes you to get pregnant, the higher your chances of having fibroids. They're called non-parity. So if you're a woman in a reproductive age group and takes like a longer time to conceive, it gives the uterus a chance to grow these fibroids.
So let's say
Also,
like women, are you like saying that women that marry late are at
yes,
risk
women
of
that marry late, or
fibroid?
even women that marry early, but yet they have issues with conceiving, it gives them the risk of having fibroids. Also, women that obesity is one important risk in because the hormones that supports fibroids also can increase the body weight. So that's why a woman that is obese has a higher risk of having fibroids, unlike women that have you know the slimmer size. What's it called?
Okay, thank you. With all of this that you have discussed, so I'm guessing there's a way to avoid fibroids because now you mentioned obese, so that means that we do what weight management. You've also
Exactly.
mentioned lifestyle choices in like the diet that we do
Exactly.
is also uh, related to obesity. But the thing
Mm-hmm.
is, there are some that cannot be avoided.
Mm-hmm.
Like you've talked about race, like if you're a black
Mm-hmm.
woman, you're at that risk, and
Mm-hmm.
oh, okay, if you're having issues conceiving,
Mm-hmm.
that sometimes the reason why a woman is unable to conceive is outside the woman's control. It's not something that's it's
Yeah.
a woman's fault or
Mm-hmm.
something that she's causing. So now it means that one way or the other, fibroids can be unavoidable, right? Am I saying the right
Yes.
thing? Because I was going to ask how to avoid fibroids, but from everything I have discussed, it's almost seems like fibroids can be unavoidable, and maybe
Be-
just like
be-
sorry.
yeah, because now if you're considering all these factors I've mentioned as risk factors, for example, for obesity, let's say a woman walks down on her weight, she tries to exercise, she tries to eat healthy, she avoids eating too much of red meat, smoking, drinking, and all those things. But think about it, she's a black woman, so that's still a risk factor. She can't, also a woman cannot control when she wants to get married, or when she wants to start conceiving. So generally, there's as much as you can control one factor, there are other factors that are involved that predisposes the woman to having these fibroids.
So I
But
would
we
say
live only.
that I would say that we can manage our risk of fibroids, but
Exactly, we
it's
can
not
manage it,
entirely
but we cannot
avoidable.
avoid it.
Yeah, we
Exactly.
cannot eliminate that risk, but it's something that we
Exactly.
can manage.
Manage.
The lower
Exactly.
exposure we have, then the better. Unlike doing everything, you're obese, you're black,
Yeah.
your lifestyle
Yeah.
choices are bad, you're
Mm-hmm.
probably not conceiving. All of those things. Two out
Mm-hmm.
of five is still better than 5 out of 5. So I would say
Exactly.
that's still
Exactly.
better. Thing I was going to discuss is almost related to this. Like, is it normal to have fibroids, which we've already discussed earlier, but maybe you want to
Mm-hmm.
put more light on that. Like, is it normal to have fibroids?
Okay, I'll say it's normal. I would say it's normal to have fibroids because I know the society has placed some stigma on some women that have fibroids, but it's not supposed to be so. Like I said before, women are fibroids are non-cancerous. They are not cancer. The tendency of it growing into becoming cancer is very, 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 very limited. I think they are still trying to research on that. But for now, with the information we have, there's nothing to be stigmatized about fibroids because it's not what you can control, even though you can control some factors like we mentioned before, but it's just something that just grows on its own. Like it's just if you're in a reproductive age group as a woman, you have the tendency of having it. If you're a black woman, I mean, it's just normal. It's something and it can be managed. It can be managed. Like I said before, it can be very asymptomatic. Like it doesn't present with any symptoms. So if a woman has it and she's not having any complaints, then she has nothing to worry about. But if it happens to come with complaints, then there are managements, to control it, and then the woman will be fine.
All right. Okay, so next thing, let's discuss signs and symptoms of fibroids in women. Because no, you discuss that it can be asymptomatic, like people might not discover it until
Yeah.
maybe they get pregnant. Like I
Yeah,
discovered
or they
mine.
go for gynecological examinations,
I didn't even discover mine during all the gynecology visits I was doing. I've been
Mm-hmm,
consistent in my gynae visits, and I did not discover it until pregnancy.
mm-hmm.
So, what
Pregnancy.
are some? Or maybe it was there, but I think I was blind to it because I was associated.
Sometimes it can be, sometimes it can be very small. It can be as small as a seedling, and it can be as big as a watermelon. So if
Mhm.
it's very small, most times it will not be noticed. If you go for ultrasound, it may not be seen, it may not be that visible. But pregnancy, like we're still going to, since we're about to talk about the
Signs and
symptoms of fibroids, yeah. So I'd like to classify them as, signs and symptoms that can be present outside of pregnancy and with pregnancy. So generally, for outside of pregnancy, a woman can come with she presents and say she's having extreme menstrual flow, unlike her usual unlike her usual flow. She's bleeding excessively. Intermenstrual bleeding can be there. Pelvic pain while she's having a period. Low back pain. There's pressure when she wants to pee. So many things. Even some women have pain when they have sex because of fibroids. So generally, these are common in those symptomatic group. For in pregnancy, it can be more comprehensive because the child and the fibroid are trying to compete for the space in uterus. So a lot of pressure pull. So there will be pressure, pelvic cramps here and there. There can be, some well, it was said that, or it was discovered that at some points in pregnancy, there's a little risk of even miscarriage occurring because the
with
baby is trying
fibroids.
to grow, yes, with fibroids, but not in all cases.
Fibroids can even be a risk for what's that? Conception. It can affect conception.
Yes, it can affect conception, but it depends on the location. So generally, as much as fibroids are like common growth, they have locations, and how the locations affect fertility is different. So if we have there's a particular type of fibroid that grows in the wall of the uterus. It's called a submucous fibroid. So it
So
grows in
what?
the wall of the. It's called submucous.
Okay,
Submucous.
okay, okay. I'm going
Yeah,
below. Submucous. Okay, thank you.
because it occurs it grows in the wall of the uterus and then grows into the cavity. So there's a lining in the uterus where the baby grows basically. So a submucous fibroid will grow in that lining and
Hmm.
extend into the cavity of the uterus. That can be, very it can be a very complicating factor for fertility. So it can affect the egg, the sperm, whatever has been fertilized from fertilizing or from implanting on that lining. Hence, there will be no fertility. Or sometimes it depends on also the location. Generally, the fibroids that are outside of the uterus are actually better than fibroids that grow inside of the uterus. We have the one that can grow on the wall outside, that's intramural. Some can even be on the cervical wall. So those ones on the cervical wall affect delivery. So at that point, the woman may be, considered to have a cesarean section, or like having to go through a vaginal delivery because the
Hmm.
fibroid is affecting the cervix wall. It can also be pedunculated, that it has a stalk. It can attach, like a stalk may make it attach to the uterus, and then just fall out of the uterus. So it's not really on the uterus. So those ones may not be an issue for fertility generally, but we should be more concerned for the one that grows inside of the uterus. That's the
Wow.
submucous. So those ones can affect fertility, but generally, fibroid is not expected to affect fertility. But sometimes, like I said, depending on the location, it can also block the fallopian tube from, and the fallopian tube is connected to the uterus. You need the fallopian tube to, carry
Mm,
the
yeah,
eggs
yeah.
and to the uterus. So if it affects that, if it's in that location, it will definitely affect fertility. But outside of those locations, then fibroids does not affect fertility generally. But it
Okay.
can affect pregnancy, like during pregnancy. So when the child is growing, like I said before, it competes. The hormones that is supporting the growth of the child is also feeding the fibroids. There are some cases
Also,
whereby we have,
like the blood supply.
Yes, exactly. To both the fibroids and the baby. So we also have some things we call the effect of fibroid on pregnancy and the effect of pregnancy on fibroid. So effect of pregnancy on fibroid means that the pregnancy is actually dominating over the fibroids. I'm trying to explain it in simple English, so for everybody to understand. So the pregnancy is, dominating over the fibroid, and the fibroid is shrinking, is not growing. But the effect of fibroid of pregnancy is that it's overpowering the baby, and it's growing. Even and when you almost the uterus is not so, as much as it has this muscular layer that makes it expand and all those things, it has its limits, right? So the baby growing, the fibroid growing, if the fibroid continues to grow higher or at a faster rate than the baby, it will shrink the growth of the baby. So those are the things that can lead to miscarriage, extreme bleeding, and all sort of, those
During
complications, right,
pregnancy. Wow,
during pregnancy.
that's
Yeah.
a lot. That's a lot. And I think the next question I was going to ask, you've already answered this, and that is like, do women with fibroids get pregnant? So you've said that it's not really supposed to affect fertility,
Affect
though it can happen
can affect,
depending on
yeah,
the location. So it doesn't mean that if you have fibroids, you will not get pregnant. It just depends
pregnancy, exactly.
on the. So in that sense, I would say that it's very important to get checks even before conceiving,
Exactly.
for every, especially for every woman that's also maybe a TTC person that is trying to conceive and has been
Mm-hmm.
waiting. That should be part of the checks to be done, like
Yeah,
ensure that there's no blockage anywhere. The five.
because they grow in size. Like I said before, they grow in size. This month you can see them very tiny, and then the next month you see they've increased in size. So it
So,
can be, so every
regular monitoring is
regular,
important,
exactly, regular
especially
monitoring is
if you've already
important.
known that you have it. But if you do not know that you have it, still have it checked. Like for my own case, I
Yeah.
wish that I had known before I got pregnant. Like
Mm-hmm.
I really wish I had known before I got pregnant, but I didn't know until I got pregnant. So women, again, I'm also using this opportunity to encourage that we always get ourselves checked. A lot of things happen in a woman's body. There are a lot of things that are being caused by hormones.
Yeah.
A lot of things that hormones are responsible for happening in a woman's body, and you never can tell. So it's always good to be on the
Mm-hmm.
be on the safe side and ensure that you get yourself checked.
Correct.
Have
Yeah.
your wellness exam done regularly every year. And if the doctor says that you need to come back in the next few months for a follow up, do not miss it. Have everything checked. Ask the right questions.
Mm-hmm.
Always seek medical opinion about the decisions that you want to make. So, guys, so we have to like pause this video and continue because, as you can see, our video has gotten darker thanks to Nigerian situation. Never expect power always. We'll still continue. We're recording at night because she's a very busy person, and so please bear with us on our background. And so the next question I was going to ask is you've already discussed it as well, and I believe everybody knows that fibroids grow, they do grow. Sometimes
Mm-hmm.
it might be very tiny, and before you know, they are grown in size. So I just want to ask, what are the contributing factors to that growth? What causes fibroids to grow and sometimes even grow so fast?
Okay, so generally, like I said before, it's hormonal. The hormones supporting pregnancy, the hormones supporting the reproductive age is what will make the fibroid grow. Like even if it's this size today, you can get there tomorrow. Like you go for a scan and then you discover that your doctor is telling you that okay, it has increased in size, and they can be multiple. You can see one growth today, and then tomorrow you see about four or five, and they can go at different rates. One may be bigger than the other. It depends, but everything, the growth is dependent on, the hormones. But then the lifestyle choices, like I mentioned before, can also increase the rate of the growth. I'm not saying it's that 100%, but there are factors that can increase the rate, like the kind of food you eat, sedentary lifestyle of not exercising, things like that can also increase. Smoking, drinking, alcohol, those ones have little risks of increasing the rate of the fibroids.
Hmm, that's something serious. So, what are the treatment options for fibroids?
Okay, so generally, like I said before, as much as everybody kind of stigmatize women with fibroids, it has a cure. I wouldn't say a cure, it has a management, because as much as fibroids can be treated or managed, they can regrow. That's what is very, that's the challenging thing about fibroids. It can regrow as fast as 6 months after removal, or even a year after removal. So first is, it depends on the size of the fibroids. We have what we call the watchful waiting. Like I said before, it grows in size, and the size varies depending on the numbers of fibroids you have. So watchful waiting is for sizes that are below 5 cm. So if they are bigger than 5 cm, then we advance to saying that, okay, if they are symptomatic, you can decide to remove them through surgery. But if they're not symptomatic, you can as well just leave them. So for a woman that is still desirous of pregnancy, or still growing a family tree and all those things, you may want to consider that factor, because this is just to avoid the challenges that you may experience during pregnancy. Either the size is small or it's big, you may want to consider removing it. Some can just, accommodate the pregnancy and the fibroid at the same time. Then maybe for the next pregnancy, it would have been removed and the healing would have occurred before then. But for some women, it depends on the choice. But medically, it's just advisable to get it removed if you want to continue to have um
in normal
children,
life.
a normal life. But the perfect, or the solution to avoiding fibroid for life is to remove the entire uterus.
Eh?
Yes, but
You
that is for
said
women. That is for women that do not desire to have children again. For example, a woman that is close to a menopausal age, she can decide to remove the entire uterus. Number one, it saves her from even having risks of cancer, uterine cancer in future. So why not? But of course, it's not everybody that can take up that decision. But that's the only thing that can prevent fibroid from regrowing. But for women that still want to keep their uterus, if it is symptomatic, if you're having too much bleeding during your period, you're having too much pain you cannot bear through your period, you're having pain during sex, I mean, it's advisable to remove it. And if you keep going for, like, the watchful waiting means that you have to, keep checking through the scan, maybe every 3 months, every 6 months, to see if it increases in number, increases in size. But if it does not, or if at any time the symptoms, like for mine, I've had fibroids before in the past, and I had to remove them. I remember my first gynae that I consulted, she gave me the advice that let's watch it. Like, I didn't even know I had the fibroid. I started having some pelvic pains that were unbearable. That was what started it, and she ordered a scan for me. Then she said, okay, it's very little in size. I think it was about just 1 or 2 then. Then she said, let's go for watchful waiting for 6 months. I was scheduled for a rescan at 6 months. Then 6 months after I went, I discovered that it had grown in numbers and also in size. So I had the option of, okay, do I want to remove it or do I not want to remove it? As at that time, the symptoms were not so aggressive. But as time went by, it became very aggressive for me. I was bleeding excessively. I was having pains, all those things. So it was uncomfortable. So I had to take the option of removing. So I had the fibroid surgery called myomectomy, and that was it. So watchful waiting can last for a long time. At the same time, cannot, because of the rate at which the fibroid grows, which you can't determine. So if watchful waiting works for you, fine. But if not, if it continues to grow, then the option of fibroid is there. The fibroid is not all fibroids are life threatening. Even taking medications, I know most women are scared of going under the knife and all those things. Some women would not even want to go for
yeah,
C-section.
some will use like traditional means, herbal methods, or shrinking
Yeah,
the fibroids.
those things don't work. Let me just tell you. Any herbal doctor or any seller, whatever, that is selling, oh, just drink it 5 times a day, you will pee it out. Those things don't work, honestly. The solution to this is either to remove your uterus or to have it operated.
But
But
they
I
can shrink. I've heard about shrinkage. One of the ways I've heard about trying to shrink fibroids is through your
Mhm.
diet. Like I
Yes,
remember when I was having my own episode, one of the things I was researching about was like fibroid diet. And part of fibroid diet is you totally reducing your carbs. Like it's like carb
exactly.
and sugar food items, they kind of they increase the rate at which they can grow. They can
Bro, yeah.
they can influence the growth of fibroids. But if you can cut off carbs totally, cut off like
So
sugar
it's not
products.
100%. Even if you can cut it off, it's not still 100% that it will
Yeah, but
shrink.
it's something that is helpful. It's helpful in
Yes,
managing the
can
fiber.
just reduce the size,
That's
but
the
it doesn't.
shrinkage we're talking about. Like,
Yeah,
for me, I think what I've heard about is shrinkage. No,
mm-hmm,
most things will shrink it, but it doesn't mean
mm-hmm,
that it will go
it
away.
will go away
Yeah,
exactly.
and
So
that
not like you
shrinkage
can flush it
again,
out of your light
and
is
that
back.
shrinkage, and that shrinkage,
Let's pause. Light is back. Let me on.
those things that we've said, they help shrink it.
Mhm.
But when you shrink, is it like they can still get bloated again or something? Or what happens? What's the end point of shrinkage?
On shrinkage, I think for shrinkage is just to keep them in check. Honestly, because
But
I think
does that take away like the pain and other complications from the fibroid?
no, because like I said before, it can be very small and yet very symptomatic. We can't predict what this fibroid represents with. There are fibroids that are multiple, but people don't have any symptoms whatsoever. There are some that even if you go to your doctor and they do a pelvic examination, they can palpate it like, okay, this thing is big, there's something there, but there's no pain. There is no, those women kind of have normal cycle, but it's not in everybody. So like I
But
said, it's just
I would be worried about having multiple fibroid that is asymptomatic, because I feel like those are like devils that you do not know. Because I feel like it is multiple, especially in like your uterus or the intrauterine wall you mentioned earlier. Would that
mhm.
not be like a blockage from having conception happen?
Like I said, it depends on the location. So if as much as it is multiple, they are all pedunculated or they are intramural, or subserosal, then it is really may not be a challenge. But if it is multiple and big inside the uterus itself, that is the submucous one, of course it will be a challenge. Or they are located in different angles. Like okay, like I said before, the fallopian tube region. Of course, it will be a challenge. So all these things depends on the location and the sizes. If the location is far from where we talked about, then it won't be a problem also.
So would you recommend or advise that if somebody is pregnant and is discovered to have fibroid, like do a single surgery to remove both, or have separate surgeries?
Well, I think it depends on the hospital, the country. Generally, based on textbooks, according to textbooks, so it says that it should not be removed, but the baby can be removed while the fibroid is left in place to be removed for a later surgery. But because the blood supply supplying the fibroid is a very delicate one, so there is risk of bleeding that can eventually, if it is not well controlled, can lead to the death of the mother. So that is what we try to avoid in such places. But I've seen some fertilities that will remove the baby and remove the fibroid at the same time, and yet there is no risk of the bleeding is minimized. And there are some that would, like I said before, leave the fibroid and then take out the baby and schedule you for a later date to come remove the fibroid. It depends on the facility, it depends on the surgeon, how competent the surgeon feels that, okay, he can do this or he cannot do this. And it depends on the law in any country. For example, I mean, maybe in the US, maybe they won't, most fertilities in the US may not want to do that. But I think in Nigeria, some fertilities will do that also. Some, not many.
Okay, so like, are there other fibroid complications that we've not mentioned anywhere, or we've not discussed that we should be aware?
Well, I think we've touched a lot of places about it. Okay, so in summary, I'd just like to bring all these points we mentioned together so that we can have something to take home. So fibroid, like I said before, they're non-cancerous. So if you have the idea about fibroids being cancerous, please delete it from your mind. They're non-cancerous. They're manageable. They have symptoms and they may present without symptoms. The best option for fibroid is to remove it. But if you're removing it, please consider that you're going to have get pregnant as soon as possible just to avoid it from regrowing. And if you don't intend to have any babies in the nearest future, you can as well keep it if you know you can manage it. There are some medications though that can be used to reduce the hormones that supply, that influence the growth of the fibroids. I mean, I don't know if they are really used in Nigeria, but I know they can be used abroad. But they're not really widely used actually, because I know they can be used over there. So you can sort that out. If it's the better option for you, you can go ahead and try it. But if you know you can bear, the symptoms that the fibroids presents with and you want children, please do that. So, but the advice I'll give to every woman out there is please schedule a routine checkup with your gynecologist every 3 months, every 6 months, every year, as much as it be convenient for you. You can do that regularly. And also I would advise everyone to know what is your body's normal and what is abnormal. Because if you know your body is normal, then when there is this a slight change, quickly go and attend to it, and then it can be managed well.
Yeah, I agree with you on that point, especially for somebody that is used to having pain during period. You should know the
Mm-hmm.
type of and level of pain you usually have.
Okay,
So
you
that when,
have. Mhm.
because I think that was one of the things that I should have suspected, but I just assumed it was normal based off of my
Mhm.
previous pain experience. But I didn't
Right.
pay attention to that part. That should have been something
Mhm.
to make me go check it out. So for every woman of reproductive age, as I've discussed, if you are getting married, even before you get married, don't wait to get married.
Yeah. Mhm.
Get married before you go for routine checkups with your man.
Yes.
Always prioritize this. This is your health. And we've said
Mhm.
it, a woman's body, a lot of things are ongoing. There are a lot of hormones are raging that are causing different
Mhm.
things. So it's always good to be sure. This one is not a matter of God forbid. This is
No.
a matter of God.
Though God works, I'm
No,
all
I'm not
about faith.
saying that God does not work. Definitely, no. But I'm saying that knowledge. God is the one that
Yes.
equips us
Yes.
with knowledge. You know, a lot of
Ignorance
time,
kills.
yeah, a lot of time we feign ignorance of things that are already there. Things
Yeah.
that the earlier you discover, you can, even if it's prayer you want to start, you can start early enough. You get
Yeah.
because you know it is there. You know the kind of focus prayer you want to pray.
You want
You
to
know what
pray.
you believe in. And if you are seeking medical help, you are doing the right things. If you need to change the
Exactly.
diet, you are doing it at
Mhm.
the right time. So it's always good to, early discovery always makes a difference.
Yes.
Always
Yeah.
very good. So that's just what we're saying. So thank you so much. I've enjoyed this session. I learned a lot. I hope you guys have learned so much as well. If you have any question around women's reproductive health or generally about your health that you'd like her to answer, please leave your comments down below. There's no free consultation. If you want if you want personalized consultation, you can talk to me. If I like you, maybe I'll give you our contacts. Just kidding. But anyway, if you have questions, leave your questions down below in the comment section, and I will pass it on to her for her to answer your questions. Thank you so much. So till we come your way again, guys, do take care and be in good health. We love you. Bye.
Bye.